All right, let's talk about the acromioclavicular joint, this area right over here, which frequently gets missed. Here's how it gets missed. You have a normal x-ray. You look at the x-ray and say there's no fracture, and then you tell the patient everything's good, there's no fracture. As a pet peeve aside, if you do this, you will look like a yutz. Always look like a yutz. If you are showing an extremity film to a patient, and which is always a good idea, and you see nothing that's fractured, do not tell the patient under any circumstances that there's nothing fractured, everything is okay. The obvious thing is that not everything is okay. You can have a ligamentous injury. Keep in mind, x-rays only show bones. They will only show a ligamentous injury if there's an obvious distortion, right over here, of the normal bony anatomy. What you want to say is there's no obvious fractures on x-ray. The films will be overread by the radiologist, but I'm comfortable that there's no fractures on x-ray. Keep in mind, though, that that doesn't mean there's not an injury. You can often have injuries to the ligaments, and it will not show up on x-ray. The only reason that you will have a ligamentous injury show up on x-ray is that if there is a distortion of the normal bony anatomy. I can't tell you how many times that I've had complaints from patients and where somebody will tell them that the x-rays look great, there's no fracture, everything is okay, and then later on they have significant pain and injury, and they go to physical therapy, and it's found out that they actually have an injury to a ligamentous structure. Don't say that. Don't do that. I don't know how much to stress that. One of the primary issues in medicine, in addition, your obligation is to take care of the patient. The obligation to yourself is not to be a yutz. Proving once again there's a Yiddish word for every description under the face of the earth.